VSD stands for ventricular septal defect. It is the most common congenital heart disease. There is a communication between two ventricles. VSD may be located at membranous part or muscular part. Membranous part, that is interventricular septum, is called the membranous VSD. It is most common because membrane lo ஓட்ட போடுறது is easier when compared to muscle lo ஓட்ட போடுறது. VSD is common in females. Just like ASD, VSD is also common in females. Something with the heart is common in females. Hemodynamics of VSD. A VSD results in shunting of the oxygenated blood from left to right because the left ventricle has more pressure than the right. So it's just like the left is going to suck up all the blood from the right side. That's what happens. So that's a lever. Okay, once again, lever. So like left to right. Shunt. So the blood flows from the left ventricle to the right ventricle. What? Yeah, so like left to right. So left to right ventricle due to the high pressure gradient. Oh, so because the left ventricle has a lot of pressure, it's going to push all the workload to the opposite side. That's what happens. So blood flows from the left side to the right side due to high pressure gradient. Pansystolic murmur and systolic thrill happens. Because the left ventricle starts contracting before the right ventricle, pansystolic murmur starts early, masking of S1. This pressure gradient is maintained throughout the systole. Pansystolic murmur lasts longer, masking of S2. So it starts early and it lasts long. Towards the end of the systole, the declining left ventricular pressure becomes lower than aortic. So early closure of A2. Okay. Left to right shunts occurs during systole at a time when the right ventricle is also contracting. Therefore, left to right shunt streams to the pulmonary artery more or less directly. So there's no volume overload on the right ventricle. So the size of the right ventricle is normal more or less. Increased blood flow through the pulmonary valve, so pulmonary ejection systolic murmur is heard and there is a delayed and accentuated P2. Early closure of A2 and delayed closure of P2 causes a widely split S2, but this is usually masked by the pansystolic murmur, but again, widely split S2 is seen here too. Larger volume reaches the left atrium, so left atrium undergoes hypertrophy. Increased blood flow through the mitral valve causes accentuated S1, but this is generally masked by the pansystolic murmur and delayed diastolic murmur. Okay, so PSM and DDM are the murmurs which are seen in VSD. PSM is pansystolic murmur, DDM is delayed diastolic murmur, and we already know that the left atrium is going to undergo hypertrophy in case of VSD and also PDA. In ASD, there's no left atrial hypertrophy, instead, there's a right atrial hypertrophy, especially because whatever blood enters into the left side is going to go to the right side because of the aorta. That is why. And then note ejection systolic murmur of the pulmonary valve cannot be separated from the pansystolic murmur. So like the only thing which we will be able to hear is the pansystolic murmur. Not even the heart sounds. That's not like audible so much. The effect of ejection systolic murmur is a selective transmission of pansystolic murmur to the upper left sternal border, which is like the pulmonary valve area. The right upper sternal border is going to be the aortic area. The left upper sternal border is going to be the pulmonary area. The lower left sternal border is going to be the mitral, it's going to be the tricuspid area, and the apex is the mitral area. Okay. So about the pulmonary valve area, in this area, the ejection is in this area, ejection characteristic of this murmur can be recognized since it does not mask the aortic component of S2. For the same reason, a second heart sound can be heard in the pulmonary area where it is not masked by the pansystolic murmur. So if you want to specifically look at, I mean, here the specific heartbeats, despite the presence of pansystolic murmur, which is a rumbling, we will be able to note the specific heart sounds at the specific valve areas. So that's about the first part of VSD. So we know the hemodynamics, but like clinical manifestations will be done in the next video. So just a summary, VSD is the most common overall congenital heart disease. It's common in females when compared to males. It's of two types, membranous and muscular. Membranous is common. We know the hemodynamics. It's a lever, so left to right shunt happens. And then there is a murmur, which is called a pansystolic murmur, and another murmur is called a delayed diastolic murmur. And so this is going to mask S1, S2. And the A2 is going to occur early, P2 is going to be delayed and accentuated, which is why there's a widely split S2. There's a left atrial hypertrophy and an